Our kidneys are located on the posterior abdominal wall. The kidneys are located on the posterior abdominal wall and they are bilateral. We have the right kidney and the left kidney. The right kidney is located in the right lumbar region and the left kidney is located in the left lumbar region. This is a kidney in sagittal section, and here you can see the kidney in transverse section. Here you see this is a transverse section of the abdomen. You can see a kidney on this side, which is the left kidney, and a kidney on this side, which is the right kidney, in transverse section. This is the vertebral column, and here to it you have the inferior vena cava. If this is the inferior vena cava, this is the right side. If this is the aorta, this is the left side. So this is the left kidney, this is the right kidney. This is the abdominal wall, posterior abdominal wall, because it's a vertebral column and they are bilateral. In sagittal section, this is how it looks like. It's being shaped. The kidney is lined by layers. The kidney is lined by layers which are protective. Renal capsule is in contact with the surface of the kidney. On top of it, we have the perirenal fat. So the protective layers are four. From out, the renal capsule, the perirenal fat, the renal fascia, and the pararenal fat are the ones which protect the kidney and absorb shock. And even when you look at them in transverse section, this is the left kidney in transverse section. Remember, the left kidney is near the aorta, and the right kidney is near the inferior vena cava. Never forget that. So this is in transverse section. You can see the renal capsule, the perirenal fat, the renal fascia, and the renal pararenal fat. These are the layers which are the protective layers around the kidneys, and they absorb shock. The renal capsule, the perirenal fat, the renal fascia, and the pararenal fat layer on both kidneys. The internal structure of the kidneys is very important because even when you're doing ultrasound, the internal structure, you see it clearly. The outer layer is the cortex from your primary school knowledge, and the inner layer is the medulla. Is there anyone who doesn't know that? Silence means that you all know. So when you make a cross section through the kidneys, the outer layer is the cortex and the inner layer is the medulla. And on ultrasound and imaging modalities, it is very clear. However, you see the cortex sends columns deep into the medulla to divide the medulla into, what are these members? The medulla is divided into what?
Pyramids.
Medullary pyramids. The apices of the medullary pyramids are facing towards the hilum, and the bases are facing towards the cortex. So the cortex sends deep into the medulla columns to separate, to split it into what we call medullary pyramids. These cortical columns are the ones which are known as columns of Batten. On ultrasound, they call these columns of Batten. B-E-R-T-I-N. Columns of Batten. So whenever you're making an ultrasound scan of the kidneys, identify the cortex, identify the medulla, identify the columns of Batten. Then the pyramids connect to minor calyces. You remember the uretic bud? The uretic bud derivatives begin from the minor calyces. Then the minor calyces join to form the major calyces. And the major calyces join to form what? What do they form?
The pelvis.
The renal pelvis. And the renal pelvis is going to form the what?
The ureter.
The ureter. Why? And this region where you have these cavities, the minor calyces, the major calyces, there is some fat which is there. and then you'll see that it looks different on ultrasound. So the internal structure, cortex, columns of Barton, medullary pyramids, minor calyces, major calyces, pelvis, ureters. Even when you're scanning, you can see those. Can I show you an example? This is an example. Okay, this is the cortex. This is the cortex of the kidney. These are the columns of Barton. These are the columns of Barton. Those ones. And in between them, you have the medullary pyramids. And this light region where you have fat, that is where you have the major and minor calyces. And when you're doing your ultrasound, they tell you why this is dark, why this is bright, why this is intermediate. Don't worry about it. But the structure is outlined. The cortex, the columns of Barton, in between them you have the medullary pyramids, and this is the region which has the minor, major calyces. It's so bright because in between them you can see there is some fat there. So this internal structure of the kidney is very, very important, even in the making of diagnosis of pathologies. Who can tell me what is the blood supply to the kidneys? Blood supply. How do the kidneys receive oxygenated blood?
It's through the renal artery.
The renal artery. And the renal artery is a branch of which artery? From abdominal aorta. So the abdominal aorta gives off two renal arteries. One going to the left kidney, that's the left renal artery, and the other one going to the right kidney, that is the right renal artery. I'm going to look at the differences between the two arteries. Yes, both of them are renal, but they have some differences. Here we are seeing the renal artery entering the hilum of the, this is the hilum of the kidney, the point of entrance and exit of blood vessels and structures. So the renal artery enters the hilum of the kidney. And I'm going to show you that the renal artery supplies other structures, but let us begin with this and we shall build on that. So the renal artery reaches the hilum of the kidneys. I want you to follow. It branches into what we call segmental arteries. It branches into what we call segmental arteries. The segmental arteries, when they reach the columns of Barton, they divide into what we call interlobar arteries. Have you seen these two? Renal artery, segmental artery, interlobar arteries. The interlobar arteries, when they reach the base of the pyramid, they form arcuate arteries. These are arcuate arteries. And the arcuate arteries will then form what we call the interlobular arteries. Let's go and look at another illustration. I'll come back and see it properly. The renal artery, the segmental arteries. Then we'll have the interlobar arteries. These are interlobar arteries in the periphery of the columns of Barton. Then, when the interlobar arteries reach the base of the pyramid, they form arcuate arteries. These arcuate arteries are going to form interlobular arteries. And the interlobular arteries are going to give us afferent arterioles, which are going to supply the glomerulus. So whenever they are talking about the blood supply of the kidneys, do not end at the renal artery. You see, it's a renal artery, a branch of the abdominal aorta. When it reaches the hilum, it divides into segmental. The segmental divides into interlobar. The interlobar divide to form, branch to form the arcuate, and the arcuate form the interlobular, and the interlobular give us afferent arterioles, which afferent arterioles are going to go and supply the glomerulus in the renal corpuscle, where glomerular filtration takes place.
Excuse me.
and the veins follow the arteries. The efferent arterioles from the glomerulus drain into the interlobular veins. The interlobular veins drain into the arcuate veins. The arcuate veins drain into the interlobar veins. The interlobar veins drain into the segmental veins, and the segmental veins drain into the renal veins. So you begin from the other side, because that blood is going to be moving in counter current. So what is this, members? Who can tell me what this is? What is this?
Renal cortex.
The cortex.
And what is
The renal
this?
cortex.
What are these ones?
Column of Barton.
And what are these ones?
Renal pyramids. Medullary
And
pyramids.
what does this region contain?
The fats
Blood
and
vessels.
the blood supply.
The what?
Fats
Tissues.
and blood vessels.
And what? Fat, blood vessels, what else?
Nerves.
And what else? There is a lot here. When you look at these illustrations, they are blood
Major
vessels
Renal
calyces.
calyx.
and the
Major
calyces.
and
Yes.
minor calyces.
So it is so bright because there is a lot here. There is a lot here. But the calyces are going to become profound in conditions that I will tell you. What are the relations of the kidneys? When you're looking at the relations of the kidneys, we look at the anterior relations. But you have to be specific for the right kidney and for the left kidney. And even the posterior relations, you have to be specific for the right kidney and for the left kidney. We separate the two kidneys. So anterior to the right kidney, we have the adrenal gland. Now, the adrenal gland of the right kidney slightly comes anteriorly. Slightly comes anterior. So that is why it is indicated there. The liver, and that is the right liver, covers the right kidney, specifically the superior pole. The second part of the duodenum covers the medial aspect of the right kidney, the right colic flexure, and the jejunum. These structures lie anterior to the right kidney. Let us give an example. This is the right kidney. You can see the second part of the duodenum. So the anterior relations of the right kidneys, superior will have the suprarenal gland and the right lobe of the liver, covering the superior aspect. Medial will have the second part of the duodenum. Inferior here will have the right colic flexure. The right colic flexure is when the ascending colon is bending to form the transverse. It lies anterior to the right kidney. And this is the right kidney. It shows us that this anterior surface is covered by the suprarenal gland. This is covered by the liver. This is covered by the colic flexure. This is covered by the second part of the duodenum. And here it is covered by the jejunum. These are the relations of the anterior aspect of the right kidney. The anterior aspect of the left kidney, it is also, we have the suprarenal gland, we have the fundus of the stomach. These are the structures anterior to these portions of the left kidney. Then we have the pancreas, and then the spleen covers that anterior surface. The jejunum covers this, and then the colon, that is the left colic flexure. These are the structures which lie anterior to the left kidney, and these are the structures which lie anterior to the right kidneys. Posterior to both the right and left kidneys, we have the diaphragm. It curves and goes posteriorly. We also have these two muscles, psoas major and quadratus lumborum. They are common factors. The diaphragm, the psoas major, the quadratus lumborum are posterior to both the right and the left kidneys. Rib 11 and rib 12 are still posterior to both the right and the left kidneys. So in general, the posterior relations of the two kidneys are similar, whereas the anterior relations differ. And relations of the kidneys are very, very important. Rib 11 and rib 12, both of them lie posterior to the right and the left kidney. The left kidney is slightly higher and the right kidney is slightly lower because the right lobe of the liver is bigger. It compresses it and it descends. And these nerves, the subcostal nerve T12, iliohypogastric and ilioinguinal L1, they all pass posterior to the kidney. So you see the posterior relations of the right kidney and the left kidney are principally the same. Just that the right kidney is slightly lower because it is compressed by the right lobe of the liver. So this is the transverse section of the right kidney. You can see the psoas major and the quadratus lumborum muscles are posterior to it. And we saw that psoas major and quadratus lumborum muscles are posterior to both kidneys. And you can see those muscles in transverse section. Psoas major, which is attached to the vertebral column, and then the quadratus lumborum, which is there. These muscles lie posterior to the kidneys. And when you look at a sonographic image, we have our right kidney here. You're going to see the vertebral column around here. This is the psoas major. This is the quadratus lumborum. Psoas major. So we are having an example of the right kidney, and we are looking at this because the posterior relations are the same for both the right and the left, with the exception of the anterior relations. This is the kidney, the right kidney, because this is our inferior vena cava. This is the vertebral column. And you see the psoas major muscle attached to the vertebral column, and then the quadratus lumborum. They are kind of forming an L. And anterior to them is our kidney. So similarly, you're having this. The vertebral column is here. Don't worry about the appearance. This one they will teach you when you do ultrasound physics. But our psoas muscle is there, our quadratus lumborum muscle is there, and our right kidney is there. This is the inferior vena cava. And you're seeing that these things look the same, even when you look at the gross anatomy image and then the sonographic image, there's a similarity. And you're seeing that.
Yes.
And you're seeing anterior to the kidney. These are the posterior structures, and then this is the liver, which is anterior to it. So when you appreciate the relations and understand them, it's going to be easy for you to appreciate that sonographic image or CT image or MRI image. And this is shown in transverse plane. Still, this is another transverse plane. This is the psoas major. This is the vertebral column. This is the psoas major. This is the quadratus lumborum. Psoas major, quadratus lumborum. This is our right kidney, and anterior to it is the liver. This is the transverse section. Anterior to it is the liver. Then posterior to it psoas major, quadratus lumborum. In between them is our right kidney. I'm just trying to show you that the anatomy you're studying is relevant when it comes to ultrasound.